I'm here today with Dr. Michael Charlton with Intermountain Medical Center. Thank you for sitting down and talking with me today about a late-breaking clinical trial that you're presenting at the International Liver Transplantation Society's annual Congress. Tell us about this new late-breaking study.
Yeah, so the people who might benefit the most from antiviral therapy for treatment of hepatitis C, I would say in most of the world don't have access to the therapies because the regulatory authorities have not thought it safe or beneficial to treat people with the most severe or advanced liver disease. We looked at people who had the most severe and advanced liver disease in a series of clinical trials and compared their outcome to people who didn't receive the antiviral therapy. And there was a tremendous benefit to treating. So this question of who should we treat, when is it too late to treat, we really addressed that in some very specific ways.
Okay, so in a patient that does have cirrhosis and it gets, progressive, is there ever a point where it's too late? Is that what this study was looking at? Is it too late to try to address that decompensation of the liver?
I don't doubt that it can be too late, but what we saw in this study, within the degree of sickness, which was pretty advanced for the 600 and something patients who received therapy, the sicker you were, the more the benefit within the context of the study. But we didn't study people above a thing called a MELD score, or a measure of degree of severity above 30. So there probably is a population above which it's not safe or ideal to treat. We don't know. But within the context of the study, up to a MELD score of 30, we saw tremendous benefit.
So what is the takeaway for the physicians? I mean, at this conference, there are a lot of physicians and caregivers specific to liver transplant. What do they need to know about this research as they go back to their practices?
Well, the patients that we saw were either waiting for a liver transplant or they could be waiting for a transplant. They were that sick. Many of them were able to improve enough either to have completely normal liver tests or they were well enough to come off the liver transplant list. And that means that if you have a donor organ and there's never enough donor organs for transplantation, you don't only save that patient's life that you treated for the hep C, you enable that donor organ to go into somebody else who needs it desperately. So you can conceivably spare 2 lives, save 2 lives with this therapy.
Okay. And for patients who are progressed, so they're kind of in that high MELD score, what should they know? Should they be talking with their physicians about this research? What's kind of the takeaway for those patients?
Ask your provider if this treatment might be right for you and maybe quote this study. We're very accessible as a study group, so people had questions in email would be quickly responded to. So I think try and prompt the question at least in front for your provider, because many providers feel like there is this possibility of being too sick before you're too sick, actually too sick to have the therapy and benefit from it.
Okay. Well, congratulations on the study being accepted to present at the Congress, and we look forward to the other research in the future.
Well, thank you.